3, 2, 1.
New York, NY. LaunchPod starts now.
Welcome to the New York LaunchPod, a podcast highlighting new startups, businesses, and openings in the New York City area. I'm Hal Cooper-Smith, and in this episode we are going to be talking about health. And if you're thinking you talked about health previously, you're right. I'm very excited because our guest on this episode is Junto Health. They are a spin-off from one of our first guests, Blueprint Health. And stepping onto the LaunchPod, we have Doug Hayes, the CEO of Junto Health. Welcome to the podcast, Doug.
Hi, Hal. Thanks so much for having me.
So what is Junto Health?
So Junto Health is a consortium of large healthcare stakeholders, think hospitals, pharmaceutical companies, insurance companies, and technology companies, who have taken a different approach to finding new innovation coming out of the tech sector. And so we work with large stakeholders who have problems or challenges in their day-to-day operations. A lot of this is coming down from some of the regulatory changes happening in the ecosystem. And we help find alignment when they have those challenges and either work together with peer institutions to find tech solutions for those problems, or we take what they're looking for and go out into the early stage part of the market and find startups that can help solve those problems.
So what does that mean in layman's terms?
So in layman's terms, we help hospitals, insurance companies, and pharmaceutical companies connect with startups that can solve the problems that they're currently facing in their businesses.
And what are those problems?
So there's a myriad of them, but some things that folks are struggling with now is a lot of the top-down policy changes that are coming both at the state and the federal level are overall great for the consumer and great for the patient, but it creates a challenge for large health systems and insurance companies which weren't necessarily built for that regulatory landscape. And that means that we have to use technology as a sector to help these organizations not only comply with regulations, but drive more value and have better care for patients themselves.
So what are some of the problems that these organizations are facing in light of the new regulations?
Yeah, so globally, the trend is to take on more risk. So as a healthcare provider, it is better if you want to move into preventative medicine, if you want to actually contain risk and keep people well rather than simply treating sick people, you need to use some pieces of technology to make sure that you can contain that risk and you can influence that patient's overall wellness. You can influence behavior. And so things as simple as keeping patients engaged in their health or educating patients or helping patients remember to take their medications, keeping them adherent. These are all changes that the current health system wasn't necessarily built to handle, and they're thriving sectors of the early stage health tech landscape.
And these changes are coming from the Affordable Care Act?
Yeah, a lot of these changes are coming from the ACA, the High Tech Act, changes that are coming down from the state and the federal level. And the visual that we always talk about is that we're asking large traditional organizations to turn very quickly, and they weren't necessarily built to do that. So the visual that makes a lot of sense to us is a cruise liner in a bay that's asked to turn around and exit the bay. It requires a number of tugboats to move that large hulking ship. You can think of the hospitals, the current hospitals, as a cruise liner, and the startups today are helping that large organization be more nimble, and they're the tugboats.
Do hospitals need to change by startups? Why are startups so essential?
Startups are essential because they're more nimble, flexible, and can attack parts of the market that are financially rewarding to small companies, but might not check the box for a large company, a large tech vendor, for instance. And so that means that they can get a little bit more creative, more patient-centric, and especially with the new wave of health tech entrepreneurs out there, they're coming up with a lot of creative solutions to the challenges that are faced by a large health system. So, a great example is New York's own ZocDoc, which 6 or 7 years ago actually started booking appointments online. This was a novel concept at the time, and now it seems relatively standardized. But that is an example of a technology platform that's helping patients connect with the care that they need and offer providers or the doctors themselves a way of getting more patient flow and actually running their business in a more efficient manner.
One of the things Matthew Farkash, who's the co-founder of Blueprint Health, who you work with, talked about is that selling in the healthcare environment is very unique because you're dealing with enterprises, and they are, as you talked about, are cruise ships. So how can startups work with these big enterprises?
It's challenging. And a lot of, when I was running the accelerator program at Blueprint Health, a lot of what we did was help early stage companies sell into these large organizations. And in a lot of ways, it takes a village. So these are small companies that makes them nimble, but it also makes them risky. It makes it difficult to integrate at the tech level. So a lot of the innovations coming from the startup universe are better if they can access the data coming out of the electronic health record, and that can be challenging. It's also difficult to sell into a hospital because their setup and their decision-making structure is often conservative and more committee-based, and that makes sense when they're responsible for caring for patients, keeping people healthy, and making sure that any technology they put in front of patients has been tested and vetted. And so it creates this chicken and egg problem for good health tech startups because they need to pilot to kind of prove that their product or their service can work and actually be valuable for the patient and for the hospital. And at the same time, the hospital is not necessarily incentivized to work with a risky solution that might not deliver the benefits that they're looking for. So it's an inherently conservative organization, as it should be. And because of that, the procurement or the adoption of new technology is very difficult.
We don't want our hospitals taking too much risk.
Not too much risk on the tech side. So they should be working with technology that has been piloted and vetted. And that's, that is a challenge for early stage companies that are looking for a large provider to, in some ways, take a risk and prove that their platform can actually perform. Once they have that, it can make those sales conversations a little bit better. But that's just on the tech side. There's an entirely different ball of wax to focus on, which is understanding where your service as a founder, where your service or product fits in with the business model of that hospital today and tomorrow, or the proverbial tomorrow. So because of these regulatory changes that are coming down, a lot of the health systems will have fundamentally different business models in 5-10 years. And so you need, as a founder today, you need to both solve today's pain point and also provide an opportunity for that hospital or health system to use your service tomorrow when they're taking more risk, when they might move to a bundled payment system, all these things that are moving down the regulatory pathway.
What do you mean by bundled payment?
Bundled payments are part of the overall shift away from fee-for-service and towards fee-for-value. And so hospitals and doctors are moving towards a place where they're rewarded financially for keeping us well, rather than just treating us when we're not well.
So who are your members?
So Junto Health has 17 members. Those include a lot of the name brand hospitals and health systems here in New York, like New York Presbyterian and North Shore LIJ. It also includes insurance companies like Aetna and Emblem Health. We have pharmaceutical companies like AstraZeneca and Boehringer Ingelheim, and a number of other constituencies, including technology providers like HP, Philips, and Samsung.
How did you get all those institutions to be members?
1,000 conversations. But this model was built at Blueprint Health while I was running the accelerator, and it was really to meet a need that we saw in the market. When I was working with early stage health tech companies, helping them refine their model and then make sales into these large organizations, a lot of that conversation needs to be informed by what the large organizations themselves are looking for. And so part of my day-to-day was working with these large hospitals and insurance companies. And it became clear to me that the way that they were engaging with early stage technology and startups generally could be improved. And so they were eager to not only affiliate with innovation and sponsor innovation conferences and workshops and accelerators, but they actually wanted to engage meaningfully with the founders themselves. They wanted to kick the tires on the new technology, and their risk tolerance was increasing. So they really wanted to roll up their sleeves and work with these early stage companies. At the same time, there was not a strong culture of knowledge sharing among peer institutions, a lot of times because they felt like they're in competitive stances with one another. And so I found myself having very similar conversations with innovation leaders from hospitals, insurance companies, pharmaceutical companies, technology companies, all of whom wanted to learn about the early stage ecosystem and meet prospective partners, but none of whom were talking to each other. And so it occurred to us that maybe we should put all these people in the same room and kind of see what happens. We started doing it. We prototyped a few meetings like that, and we found that we were really hitting a nerve, and this was really meeting a need. And so members of the collective, which it was called at that point, joined because they wanted to find good, vetted startups in a more rational way. And they also wanted to partner with peer institutions to either go look for technology or just to learn from one another to improve their own approach to innovation and technology.
So what's the goal of Junto Health?
The goal of Junto Health is to help large organizations who have problems in healthcare connect with the solutions that can actually meet those problems. So the goal of Junto Health is to help large stakeholders like hospitals and insurance companies, the organizations who care for us and our family members as patients, find the innovative solutions that they need to deliver better care.
How are you going to go about doing that?
So first, we start with the problems, or we start with the demand side. Me and my team work really closely with the innovation leaders from the membership, and we learn what their priorities are, what their pain points are, what's keeping them up at night, where they could use some help, also where they see an opportunity. And we aggregate all of those and find the alignment between different types of stakeholders. So part of our thesis, one of our theses is that in this era of convergence, there's an opportunity to work with peer institutions like a hospital, pharmaceutical company, and insurance company working together on a problem that might be solved with an early stage startup. And so first we start with the demand side. We focus on what their challenges are, what their pain points are. We then align members where we see organic alignment. And then we go out into the emerging technology landscape to find existing startups that might meet that need, or co-development partners with whom we can build a solution. We may even be able to connect members within the Junto itself who can build a better version or a next generation product that might not exist.
What are some of the hospitals identifying as some of their pain points, and what's keeping them up at night?
The list is long. Hospitals are being asked to change fairly dramatically in a very short period of time, and looking at technology to help them do that. Some of the cliches or some of the...
They're being asked to change to perform more health maintenance.
Exactly. This shift towards value is occurring right now, and within 5-10 years there will be a dramatically different reality in the way that a healthcare organization runs. And that means that they need help engaging their patients, making sure their patients have the education that they need to take care of themselves, to make sure their patients are keeping themselves healthy and have the ability to remain adherent to their medication protocols, to find the resources that they need, and to make healthcare generally more consumer friendly. It's something that we might take for granted or not really acknowledge all that much, but healthcare is not really built for the consumer. It's never been built for the consumer. And that's changing right now, in part because of this top-down regulatory shifts, but also a bottoms-up and fairly unstoppable disruption occurring within the tech sector. And as the U.S. and really people across the world are looking for more consumer-oriented healthcare, there's a lot of gaps to fill in that system. And so startups now have kind of a golden age of opportunities in front of them, because the large systems, the large existing players need to change dramatically and can't find all the solutions that they need in-house. So they need to go outside for innovation. And consumers or patients have a higher threshold of what they want out of their healthcare experience. And so I think smart founders who understand both the tech and the policy landscape have an enormous set of opportunities in front of them.
What does a future of a hospital look like?
Very different than the current model of hospitals. I think in 5-10 years, we will almost forget what the existing hospital systems felt like on a day-to-day basis. Getting the point of care outside of emergency rooms and hospitals generally will lower the overall cost of care. Being more consumer friendly and actually treating patients as the consumers that we are will make the actual experience better for patients. So things like mobile interaction with your doctor, being able to text your doctor, being able to use your phone to change your behavior or to monitor your health in a way that you may not be interested in doing yourself. The passive ways of monitoring our health and wellness, plus connecting that data back into the clinical setting, I think will make all health systems more aware. It will make patients, they'll be more in the driver's seat of their own health, and the overall cost should be lower.
You've mentioned that making healthcare more consumer-friendly is an important pain point right now. How can Junto Health help these hospitals make healthcare more consumer-friendly?
Yeah, so we work with our provider partners, our provider members, and when they want to work on a project that is innovative, it's outside the box, it's messy, and it is risky, involving the consumerization of healthcare, we can find alignment with other members and actually help them form small teams called working groups to put their heads together, focus on what they want to build or what they want to find, and then go out into the world and find that solution. And so that could be a hospital, an insurance company that are both looking for remote monitoring apps or patient adherence apps, things that are better for the consumer experience. They're more patient friendly, but they're not within the core competency of an insurance company or hospital. So those two stakeholders, they both have an incentive to find the next generation of mobile-friendly adherence solutions, for instance. And they could each go out into the world of 5,000 health tech startups and try to find the one or two that are right for them. Or they could put their heads together, figure out what they need, and amplify, kind of extend what their search is able to yield.
And so once you have those two stakeholders, they're on the search, how do they find what they need?
So that we work with our members to figure out what their priorities are, their pain points, what they're trying to solve, and then what stage company they're looking for, what type of company they're looking for, what integration is needed. There's a lot of predictable friction in the procurement process for IT, and we remove a lot of that by working with the large organizations first, by priming that demand and making sure that all the boxes are checked, and then using our experience and our network within the early stage to go out and find the right startup at the right time to make that introduction. And this is a big point to emphasize here. Selling into these organizations can be disastrous for early stage founders. You could have a very effective product. It could work. It could be very meaningful for patients. But if you don't have any cash in the bank and you haven't been funded yet and you haven't made a sale, a 6-month or a 12-month long sales cycle into a hospital, that's death. And so there is a lot of great pieces of technology that are never really actualized because of that procurement process and just the way that technology is diffused into the ecosystem. And so if we can improve that procurement process and actually get the prime the demand side and then vet the early stage, we can make a much more efficient conversation between the large organization and the small organization. And if you talk to founders as you do, long sales cycles and unpredictable sales cycles are killers at the early stage. If we can remove that, we're serving the founders, we're serving the early stage companies, and we're serving the large organizations who have used Junto Health and our platform to filter the noise and find the companies that are right for them.
Why does it take 6 to 12 months on a sales cycle for healthcare providers?
The legacy procurement processes, I won't get into the nuts and bolts of it, but it's because you want a conservative, slow-moving procurement process when you're buying things like CAT scan machines and large multi-million-dollar devices. And that's different with software. And the procurement process and the channels of getting into these health systems hasn't necessarily evolved. And, not to paint with a big brush, there are some fantastic examples of health systems that are finding good innovation, that have streamlined the way that startups can work with them, and have actually set up, either fast track pilot processes or digital sandboxes for founders to come and develop solutions in. That's going to be the way of the future, that platform approach and being a bit more open. But unfortunately, the general healthcare system is not there yet.
What would you say to someone who says we've had a 6 to 12 month procurement process for CAT scans, and that works perfectly great, and we have to be very careful with whatever we do related to health because people's lives are at stake? Why shouldn't that be with software?
I think it's a difference in kind. And whenever you're talking about innovation, you're talking about something that's inherently risky. And I'd encourage those organizations that are thinking about early stage companies to really think about risk mitigation. How can they basically carve out a sandbox to test new products in and contain the risk of a product not working, for instance? If they're able to do that, I think going out and finding innovation and then running it through a pilot very quickly within a sandbox like that can make a hospital system much more nimble, can help them find good technology, and it removes the risk of investing, in all of your hospitals with a certain startup that isn't going to be around in a year.
So once you've identified the problem, what does the day-to-day for Junto look like?
Yeah, it's a good question, and I'll point out that the majority of the work that we do at Junto Health happens after the idea. So I think there are a lot of places where folks can find new innovative ideas. There aren't a lot of places where they can actually come and get to work and help build and actualize those ideas. And that's one of the challenges that we're helping to solve. So after we identified a need among our stakeholders, we organize and facilitate a working group. So that means we get an insurance company, a pharma company, and a hospital system to basically form a team, a nimble team, and build a project plan for them. We actually do the active project management. We might build a roadmap that is 6 months, that is 8 months, that is 12 months, and facilitate and lead the development of that working group. Sometimes oftentimes it starts with a simple exercise, a conceptually simple exercise in which we talk with our members and figure out what is the challenge today? What are your pain points today? And what does the current solution set look like today? And suspending disbelief, what would that ideal solution look like tomorrow? After we do that, we can identify a set of steps that we'll have to bake into the roadmap for any working group that will help us get to that imagined ideal state. And then we launch the project with a formal charter, sign the IP agreements, and actively get these people working together. And so there's a substantial amount of behavior change that we had to kind of build within the membership. But now we've got working groups that are meeting every week, every 2 weeks, having calls, sharing data back and forth, actively building new pieces of technology. And part of the thesis of Junto Health is that coming up with ideas and interesting potential innovation is great, but the real work is done after the idea. And our model is built so that members can join these small working groups and run these disciplined experiments, as we call them, without paying that much for each one. And so they're able to lower the cost of participation in any sort of innovation search and improve the ROI, and that allows them to make more tiny bets across their organization and find innovation that they need.
So Junto is essentially leading these groups.
Exactly. And that's really why bringing in SBG and the folks at Sex Policy Group made all the sense in the world, because we're able to now take analysis of the policy landscape and things that are coming down the pike from the policy world and help our members find the technology or build the technology that they're going to need to comply with those regulations. And so we're able to find that strategic insight and combine it with a tactical, boots on the ground, blue collar approach to actually making innovation work rather than just thinking about innovation and moving on to the next idea.
What are the responsibilities for your employees?
So our employees do a mix of different things, but a lot of the work is member facing. Most of the work is member facing and learning what they need, how we can either facilitate their needs within a working group structure or in another way. So something that we do very frequently, kind of on the sidelines of working groups with our members, is run a process of curated meetings. So those are one-to-one meetings with vetted startups and one member around a targeted pain point. We also host co-development meetings, and on a quarterly basis, we're bringing all the members together. Part of our approach here is based on the idea that real innovation and collaboration requires real human relationships. And so our members meet every 3 months to share knowledge about what they're working on within their working groups, to share knowledge about what they're cooking kind of in their own organizations, and to keep the momentum and the continuity going within our community.
What's happening in between those meetings?
So in between all those meetings is where the work is done. And so the summits are a place to convene, share knowledge, network, meet more people, connect with some startups that are there. And in between those summits, the members are really heads down working in their project teams. And that means coming to meetings, joining calls, vetting technologies, building technologies, pulling in relevant colleagues into their working group roadmap. These working groups are really large commitments for the members who make them. But because we're sharing costs, we're sharing time and resources, they're able to commit to more of these innovation experiments and actually find good solutions for the problems that they have.
Are there any organizations doing something similar to what you're doing?
Yeah, there's some great models in shared research, but not many, and not any that I'm aware of in digital health. Organizations like TNO and IMEC, M2I2, the shared research program approach to innovation is nothing that we created. However, applying it to digital health in the early stage health tech ecosystem is new. And I think that right now, the industry is primed for a new way of finding innovation. And at the same time, this disruption that's coming from the seed stage, the early stage of startups, is not going to stop anytime soon. So there needs to be a better approach or a better layer in between the large organizations that have the problems and the folks that are building solutions and trying to connect with those large organizations.
How big is your company now?
So we have 6 people full-time and, like I said, 17 members. We expect to pull in a number of new members over the next couple months.
Who from these healthcare providers are participating in Junto Health? Are these C-suite executives? Who are they?
There's a range. In order to be effective, we need buy-in and commitment from the top. And so a lot of the C-suite can attend and work within the working groups. But we also need the internal colleagues from these innovation leaders. And this is something that I'd point out as a real challenge with innovation leaders generally, is that they are often sitting at a seat that has been newly created. They need to work across a matrix. And building that political capital and driving the innovations into their organizations can be very challenging because of the procurement process and some of the things that we've discussed. And so we've seen members actually use their position within the Junto as a way of attracting colleagues and developing internal champions by getting them to the table earlier and by getting their input earlier in the innovation process, so that they can work with the chair of cardiology, for instance, and learn about what he or she is looking for, and then go to Junto, use our open innovation platform to find a potential startup or technology that could meet that need. Because they're able to do that, they're seeing, and we're actually seeing a massive increase in the number of people that are joining for calls, that are coming to our summits. And it's because the liaisons or the champions from these organizations are pulling in more and more of their colleagues.
So you've mentioned shared innovation a lot, and some of your members are seemingly competitors, direct or indirect, hospitals, healthcare providers, other pharmaceutical companies. In terms of open innovation, how do you ensure that everyone's sharing notes or is being as open as possible?
Yeah, it's a good question. And the important thing to recognize is that open innovation works because you're sharing risk. And what that means is that as a hospital or a pharmaceutical company, I'm taking the problems that I want into Junto. I'm not taking all my problems. I'm not taking all of everything on my roadmap, everything that I'm going to compete with. I'm not putting that into Junto. But Junto represents a place to actually collaborate pre-competitively. And so this is based on the principles of shared research programs that come out of high-end R&D, material science, and compounds like making drugs, for instance. And what they've seen is that anytime you have a sector which is rapidly evolving and converging through technological innovation, like healthcare is right now, they've seen that you could go through a typical maturation process, and all the stakeholders in that sector spend $100 out of $100 of their R&D budget on siloed R&D, siloed research. They don't really talk to many folks in the ecosystem, and they figure out what they need to build and what they can buy to build that through a process of sales meetings, for instance. What they found is, starting particularly in Northern Europe, is that rather than take that approach, you could go to the players, the stakeholders in a sector and say, spend $90 out of $100 on your own proprietary research and throw the remaining $10 into a pot. And do that with all the relevant stakeholders and use that pot of money conducted at arm's length to do the research and to share knowledge around the commoditized or the utilitized technology. And so they've found that sectors that have adopted this approach have seen evolution sometimes in twice as fast as a traditional R&D model. And this model I'm familiar with because my brother's a scientist in the Netherlands. He runs these for the additive manufacturing industry. And the amount of innovation they've been able to drive to their members and their clients has been outstanding. The model works. They've been doing it for 15, 20 years in other countries. They've been doing it in this country, just in other sectors. And no one has really approached this within digital health. We are the first shared research program for digital health. And we think that this model long term will be a winning formula because you don't have to take all of your innovative strategy and all of your competitive ideas into Junto. You take what you need. And by combining with and aligning with other name brand partners, you're able to do more and to get there faster.
Where in the shared research model do some of these companies break off and then innovate and do their own competitive items?
Typically, within a shared research program, there's some new IP or new technology which is developed, and that will serve as like a platform or a backbone technology. Off of that, then there can be a ton of competitive products being built.
How much does it cost for members to be a part of Junto Health?
Pricing is not currently public, but part of our thesis of Junto is that innovation doesn't have to be expensive. And so we are supported by membership dues, and I think most people would find that our price of admission is a fraction of what a hackathon costs. Part of what we're proving here is that using a shared research approach, we can actually do more with lower costs and improve the ROI of all of our members.
Are you looking to get more members?
Yes, we are always looking for more members. And, the goal of Junto is not to grow the overall size of the consortium as big as we can. We're really looking for members who understand the model, who are ready to collaborate with peers, and who see the value in putting their heads together in this shared research approach and to finding new technology. So it's about finding the right partners.
I saw that one of your members, which is interesting for us as the New York Launchpad, is the New York City Economic Development Corporation. Yeah. What's their involvement?
Yeah, so the EDC we consider fellow travelers. So they do a lot of work across the city, but particularly in health tech. They run programs like Pilot Health Tech, which helps connect large hospitals with emerging technology companies. And we've worked with them in a number of different capacities when I was at Blueprint Health. We think that we're pushing the same rock up the same hill. And because of that alignment, we are able to kind of join forces, get them involved in what we're doing. And we're actively working specifically with the provider partners on developing a new and streamlined way of evaluating good technology and procuring it in a very short period of time.
What does success for Junto Health look like?
When we think about success, we want to be a platform in which our members are able to exchange knowledge very, very freely and to find more opportunities than they could doing their own thing. And so success to us comes down to the amount of working groups that we can launch, the amount of new collaborations we're able to create within the members, the amount of startups that we're able to pull into the membership and actually connect with large organizations when the time is right. We think much more, if you're thinking about KPIs, we think much more about KPIs inside the membership rather than a sales number or revenue target. The long-term bet is that if we can get these name brand organizations to actually work together to find new technology or build new technology, that there'll be many opportunities for our members and for Junto itself down the line.
What is your background?
Yeah, so I grew up in a rural part of Pennsylvania, went to school up in New Hampshire, and came out of Dartmouth, into the investment world. Quickly realized that technology was going to be the defining element of the 21st century, as I think a lot of people did, and wanted to get involved in the two different sectors that I care the most about, and those are education and health. And so I've spent some time in education technology, particularly with a company called 2U, which pioneered the school as a service model, and in healthcare technology at Blueprint Health and now at Junto Health. I've advised a number of different startups personally in healthcare and technology and education technology, and I think I'll be in the startup ecosystem for a while.
How'd you come up with the name Junto Health?
So Junto Health is an allusion to an organization that was a real historical group. It was founded by Benjamin Franklin in Philadelphia. He recognized that there is this new dynamic occurring in the colonies in which budding entrepreneurs and tradesmen were growing their businesses in ways that they couldn't over in Europe, but there was a ceiling at which they didn't benefit from being part of the noble class. And so they didn't have access to the same knowledge networks, to the capital networks, to really grow their business. And so he recognized that by connecting a number of these entrepreneurs together and forming a group based on the concept of mutual improvement, that they might all get to where they're going a little bit faster. And so they started meeting every week in a bar in Philadelphia and sharing information that would benefit the group. So they would learn about what business practices were leading to success. They would learn about anyone who lost their business and why he may have lost his business. And by sharing knowledge amongst a close group of individuals, they're able to create a very innovative crucible that create a lot of the firsts in the colonies. So the first concept of the insurance company, fire company, lending library, the blueprint for the first public hospital in University of Pennsylvania. Franklin used Junto, the model, and the individuals themselves to establish many of the firsts in the colonies that are often ascribed to him.
How do people find out more about Junto Health?
So you can check us out online at juntohealth.org. That's Junto health.org. And you can also follow us at Junto Health.
Well, Doug Hayes, we really learned a lot about the future of healthcare and health startups. It seems like you're doing a lot of exciting things. Thank you for stepping onto the New York Launch Pod and sharing our time with us.
Thanks again for having me.
And if you want to learn more about the New York Launch Pod, you can visit nylaunchpod.com or follow us on social media at nylaunchpod.
Thank you for listening to this episode of the New York Launch Pod. For more information, please visit nylaunchpod.com.